So this is a lecture PowerPoint presentation on the process of inflammation and healing. Before we start, it's important to stress that inflammation and healing are not really separable. It's not possible to have one without the other, and before we get going with the physiology of inflammation, I wanted to just talk about the value of inflammation and pain really. So inflammation in a textbook, the typical definition would be that it's the body's response to injury or trauma. It's usually thought of as a protective response, and it's intimately connected to the process of repair of tissues. Here's an example of how important inflammation and pain are. There is a quite rare condition called congenital absence of pain or congenital insensitivity to pain, which is caused by a homozygous mutation of the PRDN12 gene. Quite a rare condition. I've seen one in my time. Children with this condition often suffer damage to the mouth and the oral cavity because they bite their lip, bite the tongue, and aren't aware of it. Quite often people don't notice infections and they can exacerbate. It's quite common to get corneal damage due to foreign objects being in the eye which are not detected by the pain sensors in the eye, and often hand trauma will go unnoticed. So here's a photograph of a person who has congenital insensitivity to pain, who's had repeated trauma, infections, burns, needle injuries, which has necessitated amputations because the child cannot feel pain. And obviously, if a child is born without the sensation of pain, they don't know what's dangerous. And there are some quite famous stories of children who've been playing on hot plates and deliberately burn themselves because they like the sound that the burning skin makes. So although pain's unpleasant and inflammation's unpleasant, it does have a very valuable role. Here I've tried to show you the three main stages of inflammation. Typically in a textbook it will be divided into acute, subacute and chronic, although there is overlap between these three stages. In an ideal world, acute inflammation will resolve completely, but occasionally we'll see a chronic condition which becomes entrenched in a cycle which will not resolve. Here I've tried to show you the four main stages of inflammation over time. So following the initial insult or trauma, we have a bleeding phase where tissues are damaged, blood vessels become leaky, which we'll talk about in a few minutes' time. We have a massive inflammatory response followed by proliferation of cells, and then eventually we have a cleanup process where the body tries to remodel itself and get back to its pre-injury state to a greater or lesser degree. Here's a more detailed representation of this. We have a logarithmic scale at the bottom which starts at 0.1 days and goes all the way to a year. Same as before, but we have more detail in the cellular events here. So we have an inflammatory phase in green for the first 10 days really, peaking at about 1 day, where we have a bleeding and coagulation, activation of platelets, complement activation, and the beginnings of white cell infiltration into the tissues. Slightly later on we have a proliferative phase where we have fibroplasia, which is the growth of new fibrous tissue, angiogenesis, which is the growth of new blood vessels and capillaries, and general synthesis of new tissue. And then later on we have a remodeling stage where the tissue will become back to its pre-injury state, either successfully or not successfully, as we'll see later. The causes of inflammation are multiple. We have bacterial causes, so bacterial endocarditis. We have viruses, which can cause influenza, which will cause lung inflammation. We have protozoa, so we have the Anopheles mosquito, which is a vector for a protozoal infection. We have fungi, athlete's foot is an example. We have immunological causes as well, so rheumatoid arthritis is an immunological disease. Tumours will cause an inflammatory response. Chemicals may cause inflammation. Presumably we've all had the situation where we've changed washing powder and we've had a rash that's developed after that. Toxins can cause inflammation, and so can radiation. The cardinal signs of inflammation were first recognized by the Roman Celsus, and they're traditionally described as rubor, calor, tumor, dolor, and loss of function. And you can read for yourselves, but on this slide I've just given you some examples of why we get these individual symptoms of inflammation. One of the first things that happens is that we get vascular dilatation, where fluid escapes from a normally contained system because of retraction of the endothelial cell walls, which opens these gap junctions. White blood cells will move to the margins of the capillary walls and squeeze through the holes in the walls. Once free, they will use a process called chemotaxis to hunt down and go to the site of chemical irritation, and then they will attach themselves to the area of trauma. So what happens is that the leukocytes marginate, roll, and stick to the tissues, as we've already said. Chemotaxis is the process of movement towards a chemical stimulus. It was first detected in the 1800s by Engelmann and Pfeffer, but it was noticed as early as Leeuwenhoek, who was the inventor of the light microscope. Some of these chemicals which can cause chemotaxis are noted here. So we have histamine, serotonin, substance P, plasma proteases in the complement system, arachidonic acid metabolites, prostaglandins, cytokines, in particular interleukin-1 and tumor necrosis factor, and nitric oxide. Phagocytosis is an important part of any infection or repair process, and this is the process whereby white blood cells will swim towards and engulf alien objects. So I've just tried to show you here how that works. The outcomes of acute inflammation, well, as we said at the start, ideally we want resolution of inflammation, and this usually happens. So we will get a restoration to normal function. The chemical compounds are gradually reabsorbed and taken away into the circulatory system. Vascular permeability is normalized. Inflammatory cells will undergo apoptosis, which is programmed death of the cells, and then the lymphatic system will be responsible for vacuuming up the debris, basically. We may get a scar tissue formation, which may be good healing or it may be a problem. There's a condition called heterotrophic scar formation, which can cause a lot of pain, and quite often we won't get resolution, we'll get progression to chronic inflammation. So a lot of the patients that you see will be suffering from chronic inflammation. The causes of chronic inflammation can be multiple. We have persistent infection, prolonged exposure to irritants, repeated traumas such as prolapsed intervertebral disc can cause chronic low back pain. We don't have to have an infection to have inflammation, so we can have sterile inflammation, or we can have an autoimmune response where the body attacks its own tissues, and examples of that would be rheumatoid arthritis or multiple sclerosis. I've just tried to show you a little bit more detail here about when the specific cells appear, so you can read this in your own time. The factors that can affect healing of tissues are multiple. We have increasing age, psychological and physiological stress can decrease our ability to heal. Tissue ischemia, whereas the lack of blood supply can obviously cause the inability to heal. People with diabetes have decreased healing rates. People who are obese, certain medications can actually diminish the inflammatory response. Excessive alcohol consumption and certainly smoking can cause decreased healing ability, and obviously immunosuppressed conditions or immunocompromised conditions and poor nutrition. The local factors that can affect healing are things such as infection, localized edema, local ischemia, or a foreign body in the area. All of these things will inhibit the ability for a normal healing process. Just wanted to give you an example of tissue that heals perfectly well, which is bone. So here I've tried to show you three illustrations. The first illustration is the initial fracture, where we have this massive trauma to the bone. We then have a proliferative phase where the man with the shovel is trying to fill the hole with callus, and then eventually we will have remodeling, where we have a return to the pre-fracture state. One of the most useful analogies that I find when teaching acute and chronic inflammation is to compare acute and chronic inflammation to a burst water pipe or a swamp. So in an acute inflammation, such as a sprained ankle or a cut, it's very much like a burst water pipe. Your job is to go in and turn off the stop tap and stop excessive bleeding and limit the damage. Most of the things that the physiotherapist will do in the early stages are damage limitation. However, if we have a patient with chronic low back pain, the situation's different. We have a situation which is more like the swamp. So we have hypoxic tissues, we have venous stasis, we have an accumulation of metabolites, and generally sometimes our job is to try and go in and revert the condition back to an acute state and to get things moving. So I always think about this as going to the swamp and putting an egg whisk in and trying to stir things up a little bit. Here's an example of how well tissues can heal in a child. So here's a fractured humerus in a little boy. Here we have the fracture on day 1. We can see a nice clean spiral fracture in the mid-shaft of the right humerus. Day 4 we have also a clean line, but we've now started to see angulation from where the muscle spasm is starting to pull. But by day 7 we can start to see this huge expansive callus, which is this temporary bone. By 2 weeks we can see that the angulation is starting to correct itself and the callus is becoming more and more formed. And by 6 months the fracture's almost gone. Slight bowing of the bone, but that will disappear with time and normal use. So I just thought that was an interesting example of how well some tissues are able to regenerate, and some tissues can heal fully. Liver cells can regenerate fully, but some cells cannot. Just a little quiz here. I've got 6 pictures and 6 different causes of inflammation, which I thought you might want to have a try at. And that's it. Thank you.